Now, today and time, we would like to engage you in a health interview. This is our health corner, and we will be talking and delving more onto the role of the private sector in bridging the healthcare funding gap. In studios, I'm joined by the head of claims at Jubilee Health Insurance, and he's none other than Dr. Maurice Ego. Thank you so much for joining us.
Thank you.
Yeah, I understand you're a pediatrician.
No, I'm not a pediatrician.
You're not?
Yeah.
You're denying? Thank you so much for joining us. Okay, the role of the private sector in bridging health care funding gap. What is this about?
So thank you so much, Patricia, and thank you for the invitation to UBC. So as healthcare players, private healthcare players, there's a very big role that we have to play, especially in making sure that we have access to quality health care for the population. And so for us, we come from the side of insurance. So what that means is that we are able to fund the healthcare needs of a section of the population. So our role as insurers is to make sure that our people or our clients are able to access quality healthcare through the different policies that we have available for them. So we can bridge that gap through the funding models that we have as insurers.
Mm-hmm. Okay, so basically as health insurance providers or insurance providers, and then quotes the health department, you step into this game to bridge the gap of healthcare funding. So is this specifically for the whole mass market, or it's specifically for a different group?
Yeah, so insurance is available for everyone in the country. The last census that we had gave us a population of 47%. And when you look at the statistics for health insurance in the country now, we have about 1% of the population having access to healthcare insurance. So what that means is that we have a very big opportunity as insurers, but also there's a big percentage of the population that can benefit from health insurance. You see, we have a lot of people who may need quality health care, who may need to access certain doctors, who may even need referrals out of the country, but they cannot afford that. So what happens is, as insurers, we're able to support that need that is there, but also we're able to provide different options for the population out there to be able to access quality health care when they purchase some of the policies that we have.
So what's the criteria?
So there's no particular criteria for accessing health insurance. So anyone who is Ugandan, who may not be Ugandan, can purchase a policy.
No, why am I asking criteria is that does anyone qualify? If I come with 10,000 shillings, can I qualify for health insurance?
So how we look at the different policies that we have let me speak for Jubilee Health Insurance, because it's the one I represent. So we have different packages that we've developed that have different amounts that you can use to purchase. So I'll give you an example. Last week, we launched the J Junior medical policy, and this covers children specifically because we have a need, and our children's needs are very unique. So this covers children between 0 to 17 years. Okay. But then for as low as 1 million Uganda shillings, you can purchase a policy with us under the J Junior, and then the benefits in that policy are numerous. So you're able to cover your chronic conditions, so children who may have epilepsy, children who may have asthma, children who could have diabetes. And even when you need referrals out of the country, we're able to support you on that.
So this 1 million is on a monthly basis?
No, it's a one-time payment that covers the whole year.
Okay.
Okay. So the concept of insurance is to be able to support you when you least expect it. So if you need a surgery that is 50 million Uganda shillings, you may not have the cash now.
True.
But if you've made your payment premium of 1 million Uganda shillings, the insurer can be able to cover that surgery for you.
Okay.
So it's able to support you in your hour of need when you need that surgery, when you need that referral abroad, when you need that medication. But
then this money is refundable?
This money is not refundable. That's not
quite interesting.
So when you pay a premium, it helps the insurer to support you in case you need the service.
But of course, a year can elapse without you getting sick.
Yes.
And then also that's another benefit on your side. Okay,
Yeah.
I would want to, as a country, Uganda, we do prioritize health reforms a lot. Even when you look at the budget allocation, you see that the health sector has been, really prioritized in the areas of the facilitation. But don't you think that there should be a specific facility for the young ones? Because now it looks like you people are coming up with a small policy for the little ones. So don't you think that probably there should be a specific facility to cater for the kinder health services?
So children have very unique healthcare needs. So if you've been to a hospital with children, you'll notice that the children will run all over the place.
True.
The children will need the play area. The children could need adults to attend to them. But even things as simple as chairs where they sit on could be different. If they're going to theater, the beds are smaller. So it's important that we have a particular focus on the children, and that particular focus will help us to have a much healthier population. Because if you look at our statistics as a country, we have more than 80% of our population in the children's category. So what that means is that we have a very big young population that needs focus, especially in terms of their healthcare needs. So we should be able to have specific places, but also as private healthcare players, as Jubilee Insurance, we're able to have specific policies like the J Junior that are for children that cater to their healthcare needs.
Okay, so the J Junior seems a little bit unique. As we wind up in just a minute, how are you going to maintain the competitive edge on the insurance market? Yeah,
so as Jubilee Health Insurance, one of our hallmarks is flexibility. Okay. So we're able to cater for the specific needs of the client. So what happens is, depending on your particular needs, we're able to craft a policy that works very well for you. But then also,
so you can tailor make.
We can tailor the policy for you. Okay. But then also we innovate a lot. So we are always thinking about the different needs that different clients have through research, but also through the different bodies that carry information for the population. So then we're able to have specific policies that support. So because of innovation, because of flexibility, but then also we're able to tailor different products that meet particular segments of the market. So whether you have 1 million, whether you have 5 million, you're able to get a policy that can work for you under Jubilee Health Insurance.
Okay, Dr. Morris, thank you so much for joining us. It has been a health insurance conversation, and thank you so much for joining us. My name is Patricia Lokoma Mpango. It has been a great afternoon, a brief, great afternoon with you. Good afternoon. Let's meet again at 8 and 10 o'clock.